Just give me a second here. I want to see if I can pull up your ultrasound, okay? And I'll get one of the girls to come in, they will examine you. Yeah.
And like it's starting to affect my quality of sleep because I can't get comfortable anymore. Like my belly and whatever's happening on the inside, it's in the way. Like I'm tossing and turning. I go from left to right, depending on from sleeping on my right side. It makes me nauseous and makes me feel like unless I'm laying where there's no pressure on my other organs. If I lay on my back and I'm not elevated, then it feels like everything's kind of crushing my lungs and stuff.
Any history of heartburn and stuff like that?
I've had indigestion, yeah, but it feels like most of the time it's more like I feel like I don't have any room in my belly. It's like there's
Who's your family doctor?
I'm struggling to find a family doctor. Every time I call a clinic, they're like, yeah, we're taking patients. And then I go there and then they're like, oh, it's just a walk-in. So I'm struggling. Like yesterday I called here because there was a sign outside your guys' door. And then she said there was a male doctor still taking patients here. So I'm looking for a family doctor.
Okay.
And like I go to the hospital complaining of pain and they tell me, well, you need to go see a doctor. You need your doctor to get you to do an MRI, blah, 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 blah. And then I go to a doctor and the doctor I've been seeing for the last few months tells me to go to the Emerge if I'm that concerned. Well, no, you're the doctor who's been supposedly helping me. You keep sending me for ultrasounds. Not giving any answers, but then like yesterday I asked, like, please send me for an MRI. The ultrasound isn't able to see what's going on. There's other tests out there that can see better on the inside as to what's happening, and he absolutely refused. He couldn't even give me a reason as to why he wouldn't. He just looked at me and didn't say anything. And then finally I was just like, okay, I'm done. I'm out.
So MRI has its role, but MRI is not the one. It's tricky. So if we were to set up an MRI today, you may never get in for 4 or 5 months. That's just it. Yeah, the way MRI works. So if somebody has something that we think it's life-threatening or we think could cause problems, you don't wait for 5 months to get an MRI.
No, fair enough.
So that's the thing about the MRI. So at times, if you think this has to be dealt with within a week or 2 or 3, or something urgent. So the first step is to go through the ER. If somebody goes to the ER, they get a CT scan done and things like that, it's quicker. So maybe I can't speak for it. I'm just telling you the way things work. The office, yes, you can get it, but it takes time. It doesn't happen so quick. And at times when you go for ultrasound, if your doctor thinks an MRI will be a good test, they put it there, suggest MRI. So I looked at all your tests, you've done like 6 different MRI. Nobody suggested that. They found things on your ovaries, cyst, and they also found what's it called? A small fibroid. Okay. Just give me a minute. I just want to check this.
But that's not what's causing me any issues.
Yeah, I don't think that's the cause of this. Those kind of things will not give you that amount of swelling.
And I agree. Like, yes, there's a waiting period, but I'd rather be on the waiting list trying to get answers than not. Like, put me on the waiting list for an MRI now. Even if it isn't 4 months, I'm that much closer than rather than waiting another 4 months and then having to wait another 4 months again. Is that not true? Does that not make sense?
Yeah, well,
Let's get the referral in. And then when I go to the hospital, the doctor tells me that they're not there to use the hospitals don't use the diagnostic testing for that kind of stuff. That's what the doctor at the hospital told me on January 11th when I went in for abdominal. It was the East Side, whatever medical. I have the address.
So the nursing center is just like a mini.
They did all my blood tests.
It's a mini clinic. In that particular place, all they have is an ultrasound. They don't even have a CT scan. Yeah, so that's the thing. So they don't do too much. It's just many a times when patients go there, they see you. If they think you need, they send you to other bigger hospitals like the U of A, the Royal Alex.
Yeah, but all he wanted to do was diagnose me with COVID that day. Like, instead of sending me for an abdominal ultrasound, he marks down that he was sending me for a chest x-ray, which was not what I was complaining about. So he was more concerned about trying to tell me that I had COVID rather than actually take what I was complaining about.
So did you have COVID on that day?
No, I wasn't there for COVID. I was there because of abdominal pain, but he wasn't concerned. He didn't even come into the room to talk to me. He stood outside the door to talk to me. He didn't touch my belly once. He didn't listen to my heart. They did not listen to my lungs. They did none of that stuff to ensure that I was okay.
Sorry, can I interrupt you? Sorry. I just want to say, hello? Oh, sorry, I'll call back. Yeah. Sorry, I work in the hospital, so I get calls from the hospital. So that's why I wasn't sure what speaking to was. Yeah. So what I would do is this. So let me understand what's going on. So since April, you've had bloating in the abdomen.
It's not bloating. My belly is growing.
Oh, belly was growing. So let me get it, because he said it was full. That's what he said. He said your size of your shirt doesn't fit in. He said you used to be a size 28, but now things have grown bigger. Is that correct?
Yes.
So the abdomen is getting bigger.
Yes.
Is that right?
Okay. Yes, I now look like I'm pregnant rather than anorexic.
Any weight changes?
Pardon?
Any weight changes? Weight, have you gained more weight?
Yes, I've gained weight. I was like 118 pounds back in May.
So how much do you weigh now? She weighed
144 pounds.
Any night time, do you sweat at night? Any fever?
No.
Then somebody said that you do have like ovarian cyst. Any family history of ovarian disease?
Yeah, my aunt had ovarian or cervical. I can't remember, one of the two cancers. I can't remember.
Oh, your hand?
My aunt, yes.
Ovarian like cervical. So the other question is, any problems with your bowels?
No.
No problems. Any problem when you go to pee?
No.
Do you feel nauseous? Do you feel?
I did in the beginning, back in like May and June.
But that's gone.
But that's gone. I noticed reading on the bus the other day made me nauseous, but I mean, I can't read when I'm in a moving vehicle anyway, so that way.
Any back issues, back pain, kidney disease?
No kidney disease, but like I said, there's discomfort and pressure being put on my back and sides. I was in perfect health. I've never had this, like, I had kids, I've been pregnant before. I know what it feels like to have something moving around inside my body, and there is something moving around inside my body. Now, whether it's, I don't know, but like, organs don't move on their own. And there is something moving around inside my belly.
So are you on any medication right now?
Nope.
So the doctors that you saw
Even with broken bones, I didn't take much more than like maybe 3 trauma sets.
Broken bone where?
In my arm a couple months ago.
Okay. But nothing in the, so how did that happen? Did you have a fall? Or
I fell, and then a month later I was drugged at my friend's house. She brought me a
When was the fall?
March 22nd.
I said you were drugged in April.
Yeah.
So any information about what happened when you were drugged? Does anybody know anything?
No, the people who did it to me aren't gonna sit around and start bragging about it, right?
Nobody's gonna write anything, but people can say that. Maybe
I know, but I'm just
so
saying, the person who drugged me isn't going to sit there and tell me what they did to me. I was unconscious and unable to consent to what happened to my body that night.
So excuse me, when this happens, I've seen a few cases, they arrest those individuals and they give a report of what they did. I'm just asking, just say that yes or no. If you don't know, I don't know.
Okay.
You know, but I don't think you should make things, more complicated.
I'm not
I
making
don't
it
know.
more complicated.
Yeah.
I'm just saying the people who did this to me aren't going to be walking around telling everybody what they did. They're going to be denying it. Most rapists deny their actions. Most people who human traffic and use child sex trafficking and all of that don't sit there and announce it. Case in point, the Ghislaine Maxwell trials, Jeffrey Epstein.
So if you want to lay down there so I can get the nurse and then can examine you. Yeah, so the doctor in the ER also said the same thing, that they've done a lot of tests on you, but it just feels that there's something wrong. So I don't know. Yeah, come in please. Yeah, please can we make things faster? Waiting for a while. Can you get what's it called? One of those tape measures? I just want to check something. So yes, so we are accepting patients, but there's a process to accepting patients. So I don't see somebody the first time and I say, yes, you're my patient. Because patients need to be comfortable with whichever doctor they're going to see.
Very true.
So, and there's a process to that, so we can talk about that later. Yeah, because so I want her to measure your abdominal gate. You can stand if you want, but around the belly button. Can you? So measure 2 finger breadth above the hip, what do you have? 90.
Approximately 97.
Okay, that's good. Thank you. Do you still get your period or you don't?
Yeah. I would just not this last month yet.
So what was your last period? Please lay down so we can examine you.
The end of December.
End of December.
Yeah.
So don't you get your period every month? Or?
Yes, but like, didn't get it the end of January yet.
Okay, okay. So but are your periods regular? That's
They
the
have
question.
been, yes, up until January.
Okay. Please, you want to lay down here. So do you want to lift up your shirt? Maybe move a little bit in. I'm going to move this up, okay?
Yeah.
So can you move your, what's it called? Yeah, the pants a little bit lower down here. Any pain anywhere?
No, just, like I said, discomfort. It feels like my abs are being torn and something's pulling at the skin. And back in April, it felt like something had, like I had pain down in here really badly.
But that's gone.
That's gone,
Mhm.
but like I said, it felt like somebody on the inside had ripped, like that, my skin had been pulled back, and that it felt really raw and whatnot on the inside, and since then, I've had, my belly's growing.
So put your hands by your side. So we're just going to listen first, then we're going to examine. Have you had an internal exam? Did you go to see a gynecologist after the incident in April? Did you go to the ER? Did you do an internal exam?
No,
Did you
the
do
doctor
anything?
laughed at me and told me that my swollen vagina and the bleeding that was present in my urine at the time was based on the fact that I was probably having too much sex, which he's bold to assume because we hadn't even discussed my sexual history and I wasn't having sex. The last consensual sex I had was back in October of 2020.
So I'm going to press, okay, to
Yeah.
see if there's anything anywhere. So you need to relax, okay?
I am relaxed.
It's okay, I'm just telling you what you need to do. Can you bend your knees?
Bend your knees.
Because the abdomen is so tense. There's a lot of that. Yeah, can you take off your mask and fully vaccine if you feel comfortable? Your abdominal wall is so tense. I can't even feel anything. Yeah. So you need to relax and take some deep breaths, okay?
I'm not stressed, honestly. This is my belly right now. This is what I deal with every day.
So as doctors, we do this all the time. So you're not the first person I'm going to see today. There's a way the abdomen feels.
Mhm.
Okay, so that's why I said, please let us examine you. So we are not arguing about things.
I'm not stopping you.
Yeah, so it's better now. Why not just listen so we can do this, okay? It's easier that way. Yeah, it's better now.
Mhm.
So take deep breaths and relax. Yeah, it's better now. It's getting tense again. Any pain anywhere?
You're putting pressure onto my back.
Did you get like heartburn?
Mhm. No, foods don't affect me.
So can you blow your belly up yourself? Blow your belly up. Try to blow your belly up. Any pain when you do that?
Just where my skin feels like, and my muscles feel like they're being stretched.
Yeah, so I can't feel anything in the belly, so it's kind of hard to tell. So I think there might be a bit of, I can bring this on. Put on your shirt. Yeah, I can't feel anything there. And that's why I took some measurements to see maybe there's extra fat or if it's more obese. Unfortunately, we don't have anything to compare with because we are seeing it for the first time. So in terms of the MRI, I don't think that's the appropriate test to do at this point. If you want to do a CT scan, I can try to put in for a CAT scan to check for these structures. You know, a CT scan will also tell us about structures in the abdomen. You know, the pelvic organs, if there's anything going on there. But I can't feel anything at this point, you know. And the history you gave doesn't, I know there's something going on, there's some changes, but I can't match that with what.
Some changes, I look like I'm 9 months pregnant. I was looking like I was anorexic in April. There's definitely something going on here.
So what is your greatest fear? Maybe that would.
Look, if you look.
I don't.
Here, come here, please.
Just,
I would like you to put your hands on here, and you can feel something moving around in there.
I did. I examined it several times. I didn't feel anything.
But hold your hand on there for a little bit, and you can feel almost like little kicks. It feels like I have a baby or something, or aliens, or worms, or parasites, or something inside my belly that's moving around. I would like a CT scan and an MRI referral. I want answers where there are clear pictures of what is going on inside my belly. Because this is not normal. It is not perimenopausal weight gain. It is not extra obesity. It is not any of that. There is something actually happening inside my body, and I want answers. I have been pushed to the side. I have been ignored. I have been belittled. I have been, nobody is taking this seriously, and I'm very tired of not having the answers I need. I want some answers.
Yeah. So, as doctors, and I will listen to you, my role is to try to see what we can do to get answers. But I don't know how about the answers to everybody's questions. And I've looked at your result, there's nothing that pops up that shows anything. I've been looked at, that's why I took time to look at all the tests you've done.
I understand that.
I can't say anything there, and I said, we will try and set you up to get a CT scan. That is the best I can do right now.
Okay.
And you have the choice.
That.
If you still don't feel satisfied, you know, if you don't feel satisfied, you have the absolute right, you know, to seek help somewhere else. You know, you can go to the U of A, they have specialists there. You can get an MRI there, you can get all of these things. You can go to Royal Alex. So you have rights to check with other places.
And I agree with that too.
So I don't want you to say.
I would appreciate though if the doctors that we go to see at the walk-in clinics actually take their patients seriously and their concerns seriously instead of just schlepping us off. Not all of us are fortunate enough to have family doctors fighting for us because family doctors are scarce in Alberta. They're scarce everywhere. So when we come to see you in good faith, we expect to be taken seriously and we expect our needs to be met. And then yes, I can go to the hospital, but every time we go to the hospital for help without a family physician, we get the lecture on, you need a family physician. You don't come to emergency to get the testing. This is what your doctors are there for, and it's the complete circle of ridiculousness where no answers come about and none of the patients get what they need. And it's frustrating for the doctors and the healthcare. I'm not knocking what you guys are trying to do. The system is extremely broken, but you know, it's even worse when the doctor who is supposed to be doing no harm and being there for the patients doesn't take their patient seriously. Even though I may not be your full-time patient, you may not be my family doctor, you are my doctor in the moment that I am here with you.
Mhm.
And that is what everybody working in a walk-in clinic type of environment needs to understand. No, I may not be your everyday patient. No, I may not be yours all the time. But in the 15 minutes or the half an hour or the hour that I'm in here, I am your patient.
And that's what we're doing. Nobody has in any way tried to belittle you or not listen to you. I took time to listen to
Yes,
you.
you have.
I took
and
time to.
you have
I
been
took,
the
I,
only one so far.
So I took
in
time to
my-
listen to you. I took time to look at your previous record. Even though a walking clinic, a walking patient is supposed to come, oh, it's a quick fix. I have a sore throat, I want to be treated. I want my medication refilled. A walking doctor is a doctor that starts looking at people's medical history. That's not the whole essence. Yeah. So I've taken time to listen to, and I've told you what the next plan will be. So the next plan is to walk around getting the CT scan done, okay? Then I think you should also try and get some extra tests. I think you were saying something about parasites. I think you should get a stool test done just to check and make sure there's nothing within the stomach or within the bowels. Because if you feel that there's something tearing, some people call like a gastritis, which can cause discomfort in the abdomen. So I'll give you a script to go get that done. Then we'll book you up for the CT scan, okay? If you want to sit down here, what numbers did you measure?
97.
Yeah. Is that you put that down?
Sure.
Sure. So the CT scan, you said no chance of pregnancy, right?
Well, we don't know that because we don't know what's going on inside my belly, do we?
So you said you had your period. You said you had your period in December.
Yes.
So have you been sexually active between December and now?
No, I have not. But you know what? I had my period almost the entire time I was pregnant with my twin girls too. So that is really not this measurement of.
So the doctors you've seen in the previous time, they've checked you, done pregnancy tests a few times when you went to the ER, and it was negative. But we always want to ask because we are sending you for a CT scan, which we don't want to do in a pregnant woman. So if you are not sure if you are pregnant, maybe you should do it, But the thing is, even if you set up for a CT scan now, and you get pregnant in 2 months, that means you can't go for the scan at that time. Because they are very careful about somebody getting pregnant. And you had the scan done not too long ago. If there was pregnancy there, they will pick it up.
You would think. It all depends on who they're working for.
So are you diabetic?
No,
Asthmatic?
no,
Any anaphylaxis or
No.
reaction to anything? Any allergies?
no,
Organ transplant?
no,
Mechanical sex study? Any history of kidney disease?
no.
No dialysis? LMP, you said end of December. Do you have a date in December when you had your last period?
The 27th.
27. Okay, wait a night to get that current situation. So that's almost done. Isolation, pediatrics. Okay. Abdominal, pelvic. Okay. Any history of mental health issues before in the past?
Just PTSD from being drugged and raped. And I had an abusive husband who beat me.
Okay.
But other than that, no.
Let's see. Trophy. So 1 second. I saw the pregnancy. Yeah, beta ECG was done 3 weeks ago, so it was negative at that time. So except so I don't see nobody has done. They keep doing the pregnancy test. So I think you do the stool test for H. pylori. When was the last time you had your pap smear done?
A couple of years ago.
There's no record of pap smear here. Cervical, no tracked by screening program. I don't know what that means. Everybody should have this.
Dr. Alawani Murad was my family doctor back in Grand Prairie. He was the last one who had a pap smear done.
So how long ago was that? Because it's,
I don't know, like 3 years ago, somewhere around there. 4 years ago, maybe.
yeah, so what I say is 2018, so it's definitely due.
I usually go for yearly mammograms too.
Apart from the, you said your period was in December, do you get like abnormal bleeds, any discharge,
No.
any evidence possible STI worries?
Shouldn't have any STIs. They were all supposedly tested for not too long ago.
Okay, and it was good. Okay, perfect. So,
Well, that's what he said. I don't know. I haven't checked. But I don't have, it doesn't hurt when I pee, and I don't have any smelly discharge, and I don't have any itching happening, and none of that stuff. Been STI free my entire life so far.
got a couple of things in. Okay, so we'll do the CT scan, okay, we'll set it up. And if you don't hear anything like in a month, let us know.
Okay.
Yeah, then there's this 2 tests that I want you to do. So go get this test done. And we'll take it up from there, okay?
Mhm.
Alright, okay. Alright, okay, nice to meet you. Take
Yes,
care.
thank you very much.